We're back. Thanks for riding with us this morning. Appreciate you. You know, the Obamacare debacle is growing by leaps and bounds. The fallout has not even yet begun to be felt. There's an article out on CNS News this morning about how the bureaucracies in this administration have published 11.5 million words in the final Obamacare regulations, compared to 381,000 words in the actual law itself. What this tells us is that the unelected federal officials in these unconstitutional or extra-constitutional agencies, the three-letter ones, the administrative agencies, have written 30 words of regulations for each word in the actual law itself. And here's the problem. They haven't even begun yet. Because these regulations that are being written haven't even taken into account what the real-world scenario is going to look like. When this thing goes into effect, they're going to then have to massage it and modify it and write this one and write that one and add one to it. And I mean, here's the problem. What we're looking at right now is a law which, for all intents and purposes, has no limits and no boundaries. It incorporates not just health care, folks, but it incorporates your right to your Fifth Amendment right not to, for all intents and purposes, you're familiar with the Fifth, right? You can plead the Fifth because you don't have to effectively tattle on yourself, right? I mean, the Fifth Amendment says that you cannot be forced or coerced into revealing that which you would be used to convict you. So you have a right to to keep your own counsel, to remain silent, if you will. Well, guess what? The Obamacare project forces you to violate that, because they told us, and I did an entire couple of shows on this, when you sign up for Obamacare, you are waiving your right to not incriminate yourself. It tells you right in their privacy section and their warnings that this information will be used for auditing and law enforcement purposes. So what does that tell you? You are being forced by one law to violate your Fifth Amendment right against self-incrimination. I don't understand how anyone could review that as constitutional. And quite frankly, I'm not sure I understand why that is not a lawsuit that is making its way to the Supreme Court right now. I got to ask any lawyers out there who want to file it. I'll be your guinea pig. Are there any lawyers out there? National federal attorneys. We need a federal attorney who's willing to say, I'm willing to file this lawsuit because by forcing me to go to an Obamacare exchange website and waive my right and submit information that is a violation of my Fourth Amendment privacy and my Fifth Amendment right not to self-incriminate, you've placed me in a contradictory position I cannot escape from. That's the truth, folks. Everything else is smoke and mirrors. Now, in addition to that, word is out that this year alone, we have lost 41,000 plus jobs to layoffs in the healthcare sector. Now, the healthcare sector has been, for all intents and purposes, one of the most stable throughout the /recession /depression, whatever you want to call it. And as a result now, what we're looking at is these vast numbers of job losses that are directly related to Obamacare, because they're stealing money from the Medicare and the Medicaid funds that are allocated to implement Obamacare. And then it's going to get even worse, because everybody is going to get kicked, everybody below 133% of the national poverty level is going to get kicked onto the Medicaid rolls. And what they're not telling you, by the way, is that when you are kicked onto those Medicaid rolls, and this is another constitutional violation, you're being forced to sign up with Medicaid. Well, Medicaid has the right to come back in at a later date and charge you against any assets that you may have for any money they expend on your behalf. So, you own your home or very close to it. You've got a small mortgage on it. Maybe you're down into the $50 or $60 or $70 or $20,000 range. Your home is worth twice what you owe. You're on Medicaid because your income is low, and you've been forced onto Medicaid through the exchange, and you're given state or by the federal government if your state's not running an exchange. And you're offered an opportunity to take a job in another state. And it will be a job that will dramatically improve the situation for you and your family. And after much soul searching, you decide to take that job and you put your home up for sale. And you owe $50,000 on your mortgage on a house that's worth $150,000. You've been on this Medicaid program through Obamacare for the last 2 years. You've had a number of situations where you've had to go to the doctor. You've got a child who's got diabetes. And suddenly you sell the house, and at the closing, they inform you that $100,000 you thought was going to be net written to you in a check is being seized by Medicaid. Welcome to the new America. No one's talking about that. Where are the national voices? Where are the talk show hosts? Where are the public watchdog groups? Where are the Republicans? Why aren't they using this as an argument? Because the lower income masses are the ones that the Obama administration has counted on for everything. All of their support, all of their votes. If the Republicans were smart enough, they would educate the lower income classes in the United States of America and say, what you don't know is this is a tool that is being implemented to seize what little bit of wealth you may ever have been able to garner. This is guaranteed to turn you into a destitute slave, completely, totally, 100% dependent upon the government. Why is no one talking about this? Why is no one mentioning that under Medicaid rules, which vast swaths of the United States of America is going to fall under, anyone essentially below 150% of poverty, maybe even higher than that, because we don't even know what the rules look like yet. Where is anyone blowing the whistle on this other than me? I've not heard anybody else talk about it. It's not been on any of the major radio programs, none of the mainstream media, none of the Ministry of Propaganda. It's not been in any newspapers. It's not been talked about by any of these watchdog groups that are out there. Where is the news that says you're being forced into a program that will encumber whatever assets you may actually have managed to scrub together because you're forced to take a health care program that you may or may not want? I got to tell you, America, these are some dangerous things going on. Consumers are actually being forced to pay the doctors because of the deductibles associated with this. You know, these bronze plans have a deductible of like $5,000 per person. So basically what they are is what we used to call catastrophic health plans. Catastrophic health plan is one that doesn't kick in until your bills have hit like $5,000, $6,000, $8,000, $3,000. And it was reserved for those situations where this wasn't normal routine medical services. This was, when you got into a car accident or you fell at work and broke bones, or you required a long term of hospitalization due to an infection or, some critical disease, cancer, some kind of a life-threatening disease. Do you know that in the bronze care plans, you will be allowed to visit a doctor twice a year, and only twice a year? You didn't know that, did you? You see, the doctors and the medical facilities now are getting hip to what's going on. And so what they're saying is that when you go into the facility, they're forcing you to pay on demand up front because they know that if the bill gets submitted to your insurance company, your deductible is so high that statistically you haven't paid it, and they know it. You haven't met your deductible. So they're not even offering the opportunity to bill you for the difference after the insurance company pays, which is what all the other types of insurance used to do. They'd wait until they got their 80% from your insurance company, and then they'd bill you for the 20% difference. They're not waiting anymore. These clinics are now insisting that you pay your entire bill up front, and in some cases, they're insisting that you pay the entire remaining insurance deductible for the year before the doctor will even see you. There's a woman here on this article on Bloomberg.com, which is Barbara Retkowski. She went to Cape Coral, Florida, to a health clinic in August to treat a blood condition. She figured the center would bill her insurance company, but instead they demanded that she pay full up front. Earlier in the year, another clinic she had visited had insisted that she pay her entire remaining deductible for the year, more than $1,000. In other words, they said, you've got to pay the deductible before we'll even see you. She says, I was surprised and frustrated. I had to pull money out of my savings in order to accomplish that. This practice, according to this article, of non-emergency care and these facilities that offer it, requiring upfront payment, is spreading nationwide. And the real reason is because of the ACA or Obamacare, whatever you want to call it. The plans that are now being offered through insurance exchanges that meet the Obamacare requirements, the 10 bullet points or whatever they are, so that they're qualified as a bronze, silver, gold, or platinum plan. These are, they have low premiums initially just to get you in the door and to get the people to sign up. But they carry these massive deductibles and other out-of-pocket costs that nobody is really informed about. In California, the second lowest tier on the Obamacare plan has a deductible that's $2,000 annually. Now, this isn't like a lifetime deductible, folks. This is per year. So let's assume that you're a family of 4 and you're on a bronze plan. And it's costing you, let's just throw a number out there, of $350 per person for the 2 adults. And then there's 2 children. So you've got a total of $700 a month that you're paying for your premiums. But you also have a $5,000 deductible per person per year. So you're paying $700 a month times 12 months, right? So that's what, $8,500 a year. But then in addition to that, you've got a deductible that is multiple thousands of that on top of that. So you go to the doctor, your wife goes to the doctor a couple times, you take the kids, your total collective bills might be another $5,000. But you haven't struck your deductible because it's $5,000 per person per year. So you now have a grand total of what, $8,400, or let's say $8,000 for round numbers, plus another $5,000 in the deductibles. So, and by the way, this doesn't even talk about those things which are going to be completely uncovered. In other words, the testing and the diagnostics and all the other stuff. The hospitals are now coming out and saying that they have to charge you prior to treatment because they recognize the truth of Obamacare, which is that Americans are on the hook for their own medical costs. And once they provided the service, they know you're broke, and they know they can't bleed a stone. So their attitude is simply this: pay us in advance or find some other place to get your care. They know that they can sue you later on, but if you're in a position where you're on a Medicaid plan through Obamacare, they know that you're, for all intents and purposes, judgment-proof anyway. You don't have any assets. So basically, it's pay in advance for medical care. Now, look, if you thought, health care was expensive before, now that it's free, you're going to see what it really cost. The employers, by the way, on this same issue, are even following suit because they're pushing the workers to share a greater level of responsibility on these health insurance plans, and they're making they're raising the deductible on their corporate plans so that they can lower their overall costs. So one of the statistics they cite in this story is that the percentage of insured workers with a deductible of $1,000 or more for a single coverage jumped 34% in 2012 alone, but yet it was only 12% in 2007. Wow, that's a stunning increase. The number of people that have high deductible plans rose from 1 million people in 2005 to 15.5 million in 2013. What does that tell you? Here's the problem. And here's the proof that Obamacare is really not about offering you health coverage. That was the smokescreen and the charlatanism that they used to get you to agree to it. What it's really about is draining away the resources of the low income, the middle class. And when I say middle class, there are 3 tiers of middle class. There is lower middle class, middle class, and upper middle class, right? And the object of all of this is essentially to do this: to drain the resources, because the vast majority of America is either low income or falls somewhere in those 3 tiers of middle class. Those 3 tiers of middle class and the low income make up 80% of America or greater. So how do you get those resources? How do you get the savings accounts? How do you get access to their revenue stream? How do you get their money so that you effectively have tied their hands and they are no longer in a position where they can constructively fight back? They can't afford to hire an attorney to file suit because they got everything wrapped up in their medical costs. This is a simple methodology to spirit away and drain the wealth from the vast pool of the vast majority of America. I'm telling you, people, that's what this is about. The secondary advantage that comes out of it is that everyone at some point in time in their life needs health care, and so effectively they have a massive database on everyone. You know, one of the planks of nationalized of Marxism and socialism is that you must control the nation's healthcare system, because with that you actually, one, have access to everybody in an immediate built-in database and a file. Secondarily, if you control healthcare, you control the direction that the society takes. And thirdly, if you have control of the healthcare system, you also have the ability to influence everything about that society, because you can use healthcare as a weapon against the very people that you're subjugating. I was talking yesterday to a fella who is an EMT, and he said to me a couple of startling things. One, there's a program in Obamacare that most people are not aware of, and that's called red light, green light. And red light, green light basically goes like this. When you check into a healthcare facility and you go in there and they check you in and they take all your information and they put you into the system, then they determine what they're going to do for treatment. Each time that they go to talk about a treatment function, there is a database on the other side that either approves or disapproves of that treatment under Obamacare. So in other words, you come in and you've got chest pains, you've got nausea, and you've got a severe headache. All symptoms of heart problems, right? Either a heart attack or, something close, some arrhythmia or something else. Well, normally there are diagnostic tests that can be done to determine that. But based on your age, and quite frankly, at this point, because they know everything about you, maybe it will soon be your affiliation, your religious beliefs, your affiliation with the party, the political mainstream. Those decisions will be made anonymously on the other side and by people. These are not death panels, folks. These are individual death decisions that are being made either by individuals or a computer algorithm program with human oversight. This is so far down the road of totalitarianism and authoritarianism that there is nothing like it that has ever been seen before by the world. Meanwhile, your resources are being drained from you with these high deductibles. I got to tell you, this is, for all intents and purposes, the worst piece of legislation that has ever hit America. Dr. Ben Carson came out the other day and compared Obamacare to the reinstitution of slavery in the United States, but this time not just based on color. This time basically based on whether or not you breathe. And he's right. This is nothing more than a national enslavement program. It will enslave America to a system of dependency, to a endless circle, a spiral of death. Economically, politically, physically, emotionally, spiritually, in every aspect of life. Obamacare is not about health care. It's about control. It's about resources. It's about getting yours while simultaneously controlling you. It's about gun limitations on your Second Amendment rights. What does that have to do with health care? How is it that anti-gun legislation got built into Obamacare? The proof is, or the reality is, that is the proof that it's not about health care. There are anti-gun regulations in Obamacare. I mean, you can draw some correlation between firearms and health care in the sense that, if somebody gets shot by one, they need health care. But I mean, you could draw that kind of correlation about anything. What this is really about, folks, is not about health care. This is about control. Control of you and control of your resources. Did you ever notice the term used in a lot of corporations? Human resources? Yeah. Kind of sad. Because that's how we're viewed. We are resources. Like a farmer, like a rancher. Like a farmer goes out and he looks at his crops that he's planted, and he looks at the equipment that he needs in order to sow that seed and grow that crop and harvest it at the end of the year. Those are his resources. Like a rancher goes out and looks at his cattle and says, these are the resources that I have at my disposal. That's what we are. That is what we are. You know, Peter Kinder, who's coming on, he's the lieutenant governor for the state of Missouri. He's coming on in our next segment, so don't miss it. He recently came out and made a statement which I found stunning. He has a message for the thousands of Missourians who are looking for health insurance. And I'm going to talk to him about this in the next segment because this is weighing on our minds. It's weighing on my mind. And it needs to be discussed in an open format. Here's what he says. Lieutenant Governor Peter Kinder has a message for the tens of thousands of Missourians looking for health insurance. Don't get it through an online marketplace. Quote, I would hope there would be active resistance to this law, that people would not sign up. He says that Missourians should, quote, actively resist, opt out, and refuse to sign up. Wow. That is unusual. A top state official, remember, he's lieutenant governor, right? He's one rung away from the governorship. A top state official who encourages their state citizens to actively resist, civilly disobediently resist the federal government. I applaud that. And I wish we had a few thousand more like him in states and in federal offices around the nation. You've been listening to America's Voice Now. We're going to take a quick break. When we return, we're going to have Mr. Kinder on the line. He's going to share with us some of his thoughts on both Obamacare and the shutdown, or the breakthrough of the barricades at a federally shuttered national park here in Missouri yesterday. He did it with a host of veterans and other individuals. We're going to talk a little bit about it. We're going to talk to him about some other issues of importance as well. Stick with us. You can also catch this on our YouTube channel if you miss it for some reason, or if you watch it and you'd like to share it with a friend, by all means, please feel free to do that. You can find that by going to youtube.com/America's Voice Now. I'll post this up on our front page of our website in the news segment after this show. That's at americasvoicenow.org. And you can also find this particular interview and every other show that we do up on our Facebook page at facebook.com/America's Voice Now. We'll be right back.